Well, one of the best pediatricians, we discussed the treatment of Tourette's and certain medicines they use. And I asked them if they work. No one's sure because sometimes Tourette's, for some reason, just gets better on its own.
Yes.
Well, if you think it helped, you're going to believe it. We're not 100% sure. But it doesn't mean you shouldn't use any medication to try to control it. But is there anything in a non-medical sense you could do for Tourette syndrome?
There's something we call habit reversal training. You're really basically substituting a new behavior. So the child starts to feel a premonition of a tic coming on. First of all, again, you have to sensitize them to this. You have to really sit with them and help them think about when they get tics, or even if they might be ticking right in your office. What preliminary feeling? Is it a numbness? Is it an anxiety? Is it a burning sensation? Whatever that child identifies. So now they have again, we're developing a signal. So now, before they tick, you tell them perhaps to clench their fist or touch their shirt pocket, some other habit, some other behavior. They seem to need to do something, and sometimes it will actually lessen they find it'll lessen the tic, and the child will start after a while becoming very aware of the tic, and we don't know if it's because he's aware in a confident way, not in aware that he's getting anticipatory anxiety, but he now has a little more control over the tic. And then when you give him a movement, again, whether it's imaginary or not, it makes the child feel like they're controlling it. So they call it habit reversal. And eventually the idea, again, with all behavioral things, is that whatever you've taught them, you fade it, meaning eventually, if it's not necessary, the new habit you've taught them to clench their shirt will fade away.
I find it, some people think the kid has a little habit tic, a little blinking in the eyes, a little moving of the face for a couple of seconds is Tourette's. You got to have the condition for a year. Many kids get these habit tics for a week or two,
Yes.
or three, maybe it's really the stress, who knows. That is Tourette's.
No.
Yeah, parents immediately judge. They go into an internet site and they get misinformation before they convince themselves the kid is Tourette's. Is that correct?
Yes, and even the ones who don't think it's immediately Tourette's, although they mention it, they're fearful that it is that, they become, I try to reassure them, a lot of times tics come and go. They usually go away with age as time goes on. They usually get much better.